Burkina Faso has a vision to build a national health system that is geared towards prevention and makes the community approach to primary health care the bedrock of the country's march towards implementing the SDGs, in particular the goal to provide health for all. Today, around 1/3 of the Burkinabe are between 10 and 19 years old. The HIV infection rate has now fallen in the adult population, but risen within the adolescent population. Alongside HIV, sexually transmitted diseases are on the rise among young people in this West African state, as are teenage pregnancies. Modern contraceptives are being used more widely as knowledge about them grows. Despite such progress, Burkina Faso's population could double within the next 20 years, and HIV is likely to spread widely among young people. In the face of runaway, unmanageable population growth, ratios will no longer be respected. Today, people say the norm is one health worker to every 10,000 inhabitants, but we are so far from achieving that. Grants from the Global Fund to fight AIDS, tuberculosis and malaria have enabled recipient countries like Burkina Faso to improve and expand their health services in recent years. Since 2002, the Backup Health Programme, commissioned by the German Federal Ministry for Economic Cooperation and Development, BMZ, and run by the Deutsche Gesellschaft für internationale Zusammenarbeit, GIZ, has assisted some 90 countries to use the funds effectively. In Burkina Faso, Backup helps community-based organizations to train health workers, improving their skills in counseling on HIV and sexual and reproductive health. Their services are integrated in schools, youth centers and local HIV testing centers. Abdul Draman Bamogo is one of 70 community-based workers who receive training from a local civil society organization. We meet in informal groups and talk about sexuality and contraception, or watch short videos on the topic. I'm very keen to help my brothers and sisters with targeted initiatives and to guide them in the right direction.
À travers des actions telles que orientées sur le droit chemin.
Je ne connaissais pas.
I didn't know my HIV status, so I took a test and it was negative. Mr. Bamogo provided me with advice. I've been coming here ever since and am able to confide in him. The center opened my eyes to things I didn't know about, like diseases, STIs and sex-related issues, such as how to avoid getting pregnant and contracting certain illnesses.
Comment faire pour ne pas tomber enceinte, éviter certaines maladies et d'autres.
We focus on girls, as it is they that must often live with the consequences, unwanted pregnancies and so on. The goal is for these young people to adopt contraceptive methods. With the support of Backup Health, since 2018, almost 17,000 boys and girls in Burkina Faso have now made use of the integrated health services established and taken voluntary HIV tests.